video. My name is Rocco Cilio, All-Star Insurance Specialist. I help the vintage age generation worry less and live more all throughout the plan year, not just during enrollment season. And in today's video, we're going to do our best to help you avoid making a mistake that millions of Medicare beneficiaries make that actually cost them financially. Penalties that they wind up paying over and over and over again for the rest of their life. And again, there's millions of people that unfortunately are stuck in this scenario. So stay tuned here as we break it down. And again, we're going to do our best to make sure that you do not fall into that category. So let's take a look. All right, so here we are. I have this article here from AARP, and you can see the title. Millions of people may pay Medicare late enrollment penalties for life after missing key deadlines. That's a horrible perspective and something that certainly you do not want to have happen to you. And these key deadlines, they are things that we might not really be aware of if we're not paying attention. If you're somebody that is approaching that Medicare age, the vintage age generation, as I like to call most of you out there, then this is something here you better pay attention to. And I'm gonna go through some of the highlights here. When I go through these articles, I just try and find the most pertinent stuff in here. But this one is worth kind of digging into and making sure that we spend a little bit of time with. So you can see here, nearly all Americans become eligible for Medicare health insurance program when they turn 65. But this is important. A lot of times people delay signing up, and there's a lot of reasons for that. Whatever the reasons are, that can wind up being the cause of missing important deadlines that can actually lead to late enrollment penalties. Why would there be late enrollment penalties for people that are supposed to be signing up for Medicare? Like, why are we being self-imposed to have insurance if we fall into that category? And part of the challenges with it, we're going to look at it here, is about people who get these late enrollment penalties, they pay those in addition to their regular Medicare premiums, and usually have to pay those penalties for the rest of their life. It sounds like jail, like late enrollment penalty jail, okay? And look, the purpose of the penalties, and this is important first here, we want to be able to understand why this stuff exists, right? Because it just seems maybe totally unfair. But the purpose of the penalties is to encourage prompt enrollment and discourage people from waiting until they need costly health care to sign up. And then in addition to that, it not only benefits individuals by protecting them with health insurance, but it also strengthens the overall Medicare program because it spread its cost out broadly among a wide population. So that keeps people, the cost per person down and premiums as low as possible. However, when people get hit with those late enrollment penalties, it sometimes happens because they're unaware of the possibility of the penalties and are unsure about the steps that they can take to avoid them. So anyway, we're not going to break down all of the rules here in this video. But what I do want to make mention to you, we'll sum it up the best that we can, is that if you could see here, there are literally millions of people. There are basically two different late enrollment penalties we're going to talk about. One is for Part B and the other one is for Part D. So on an individual level, the impact and penalties can be significant. This was from 2021 where this data came from. Almost 800,000 people, or about 1.3% of Part B enrollees, paid a Medicare Part B penalty. And so on average, their monthly payment for Part B, standard premium plus penalty in 2021 was 27% higher than it would have been without the penalty. Can you imagine that you are paying a premium 27% more than the vast majority of people who have the same exact coverage just because we didn't sign up when we were supposed to? Let's avoid that. Let's not make that happen, okay? And then it gets even worse down here. As you can see, even 3 times as many. They pay a Part D late enrollment penalties. That's about 2.5 million people, and this was from 2022, or about 5% of all Part D enrollees. So late enrollment for Part A is really not even much to mention about there. And by the way, if you're just getting yourself acquainted with Medicare and you know that's all going to come up to you and you hear like, what's Part B, D, A, what we call the Medicare alphabet soup, just reach out to us if you need some help. There's a lot of information out there online, but you can get an individualized explanation of what we call Medicare 101 to break all that stuff down for you. And we're happy to do that at any time. There's never any charge for us to be able to assist with any of that sort of stuff. But essentially here, what we know about Part B is that it's one of the biggest premiums that we are going to pay in our later years when we are in Medicare. And being able to have to pay that is it's at a time where we can at least afford, most people, to have to pay additional money towards that. So we've got to make sure that we do that. Now, look at here. Say Medicare people are gonna have Medicare for the rest of their life, and when they have to have a penalty attached, that's a stage in life when they could least afford it. And all of these penalties were established to encourage people to enroll in Medicare when they become eligible. Some people end up paying late enrollment penalties simply because they're unaware of them or they don't know how they can avoid them. So the article goes on to talk a little bit how policymakers, they can do things to make you all more aware out there and that sort of thing. And that's great if some of that stuff happens. There's organizations like AARP and many others out there that like to advocate on behalf of Medicare beneficiaries, and I like to be able to support and encourage that as much as possible. But when it comes to being able to take control of our own situation, if we're not familiar with this type of stuff, then we can really put ourselves in a bind. Okay, so Part B Medicare, for those that don't know, this is the part of your Medicare coverage that helps with physicians and other outpatient services. So the government will pony up around 80% of the cost for that. And that's what you wind up having for being a Medicare beneficiary. That's an entitlement for you. The Part D is outpatient prescription drug coverage. And so those are two important components that there's a burden that we have to pay for as, well, I'm not a Medicare beneficiary yet, but when my time comes for sure, in addition to what we pay into it now when we do get enrolled, right now as of 2025 that we're in, that premium every month is around $185 per person for the Part B. And for most people, if they're getting their Social Security check, it gets deducted right out of there. But also in addition to that, the Part D prescription drug coverage that we need to have as well, very often that can come with an additional premium if we have it as a standalone. Again, we're not going to do the whole Medicare 101 thing. We've got other videos for that, and you can contact us at any time. But the point is that we have deadlines that we need to meet. If you are approaching your Medicare eligibility age, if you are already past that age, but you've continued on with your employer coverage, but you know that's coming to an end soon, you need to know what the rules are around some of that stuff, because again, once you get one of these penalties put towards you, for the most people, if you get a penalty, it's going to be stuck with you for the rest of your life. And we want to help you avoid that as much as possible. What I'll actually do is I will place a link in the description below that will go over the rules, the eligibility rules, when you can enroll, when does the late payment kick in, that sort of thing, and even how much do you pay for some of that stuff. So you can take a look at that and make sure that you are in good shape there. And but also at the same time, if you have any specific questions, we want you to reach out to us. This is a tragedy for millions of people that we want to help you avoid. And maybe even if you have already gotten yourself enrolled, but you know others that are coming up there again, so maybe you share this video with them and let them know as well that, hey, you need to be aware of this, because the government does not play with this. There's not much wiggle room for us there. And so again, we'll wrap up here just by saying let's not do what millions of people have inadvertently done to themselves. Had they been aware that the serious nature of this prior to making that decision, or if they even knew that they were supposed to enroll by those deadlines and there was consequences for not doing it, I'm willing to bet that they would have done otherwise. So unfortunately, most people, when you don't have the right information, it's going to lead to making bad decisions. We can't guess right most of the time. Okay. All right. So hopefully you got some value out of this. If you have any other questions, put them in the comments down below. Also encourage you, give us a thumbs up if you like what you see here and you continue to want to see this type of content. Put it in the comments there. Subscribe to our channel. Turn on notifications, and that way, as we release, we'll try to do a couple of these videos a week. You can be kept up to speed on what's happening out in the marketplace and ways to add value to your life all throughout the plan years. Okay? All right. Thanks for watching, and we'll be back again soon.